Time now for our U18 Sports Medicine Timeout. U18 Sports Medicine, your sports medicine provider for the young athlete. And joining us now is Dr. Stephen Storer. And Doctor, thanks very much for being with us. Let's talk about shoulder injuries in young athletes, because that often happens, especially on the football field. You have dislocations and you have separations.
Right. Those are the two most common injuries that we see with football in particular: shoulder separations and shoulder dislocations. And there's an important distinction. Shoulder separation is actually a sprain of the ligaments that connect the clavicle to the scapula, and a shoulder dislocation is actually a separation of the shoulder ball and socket joint.
What are some of the treatments for each one? Because people do get them mixed up.
Yeah, they do, and the treatment is very different.
Right.
For shoulder separation, it's almost like an ankle sprain. You can be out for as short as a week or as long as 3 weeks, and generally doesn't require surgery. For shoulder dislocation, that's when we start talking about surgery, because we often have to repair the ligaments that connect the ball and the socket, and that can be a season-ending injury.
What kind of rehab is there for both injuries?
Sure. Well, for shoulder separation, rehab is just a couple of weeks to work on range of motion and strengthening. For shoulder dislocation, often after surgery, there's a real long 3 to 4 month period before athletes can get back to playing again.
You know what Dan Marino used to say about shoulder injuries, because he never suffered one, of course, a great quarterback. He said, you have to learn to fall the right way.
That's right.
All right, thanks very much. I appreciate you being with us.
Sure.
Dr. Stephen Storer with us with our U18 Sports Medicine Timeout.